It's important you be aware that weight loss surgery, like every other surgery, has risks. Bariatric surgery is considered major abdominal surgery. You will be under general anesthesia as the surgeon enters your abdomen. Missouri Bariatric Services surgeons perform a number of different procedures that change your body, whether it is altering your anatomy, removing part of your stomach, or inserting a prosthetic device. Complications which may lead to death or disability include pulmonary embolus, gastrointestinal leaks, and cardiopulmonary complications. Also, factors that increase your risks from weight loss surgery include previous weight loss surgery or upper abdominal surgery, higher BMI, and multiple medical problems. Missouri Bariatric Services mortality and complication rates are significantly better than national averages. We have an extensive program to reduce your risk for surgical complications. Our first and foremost concern is for your safety. There are ways to reduce your risk. Lower your BMI, do not have repeat bariatric surgeries, and decrease associated medical conditions. Also, extensive pre-surgery diagnostic tests will identify and help decrease your chances for serious adverse events. Unfortunately, there are a few conditions that will prevent you from having bariatric surgery. While these conditions are not particularly common, our first concern is your safety. These conditions include hepatic portal hypertension, unstable angina, severe valvular heart disease, chronic pancreatitis, chronic long-term steroid medication use, severe pulmonary hypertension, and congestive heart failure with an ejection fraction of less than 40%. If you are currently pregnant or addicted to alcohol or drugs, you are not a candidate for surgery. You must have stopped smoking before surgery. Smoking seriously inhibits your healing process and causes irritation, so you may be tested the day of surgery. You will also be required to be smoke-free for life after surgery in order to prevent serious potential complications. You may not be a candidate for surgery if you have severe COPD or inflammatory bowel disease, have attempted suicide within the last 2 years, or if your BMI is more than 60. If a test result or consultation determines that you are at high risk for an operative procedure, if the university hospital anesthesia staff feels you are at risk for surgical intervention, or if the Missouri Bariatric Services Clinical Committee deems you are unsafe for surgery, you may not be a surgical candidate. Statistics show that patients with a body mass index of more than 60 or who weigh more than 500 pounds have a higher incidence of complications and death after weight loss surgery. We want to ensure you are the safest possible candidate for surgery. So if you have met either of these criteria, you will be required to lose weight before surgery. Should you require medical weight loss, Missouri Bariatric Services offers a program to assist you. We offer weight loss classes and require you to attend at least 3 consecutive ones before you are considered for surgery. In addition, you may meet with our dietitian to develop a safe, effective, and quick way to lose weight before your surgery. On average, you will be in the hospital 1 night following adjustable gastric band surgery and 2 nights following Roux-en-Y or vertical sleeve procedures. If you have severe diabetes, you will be required to stay an additional night. Members of our bariatric surgical team will check in on you during your hospital stay to ensure your safety at all times. Your family may stay with you during your hospitalization, however, it is not recommended. Please ask the Missouri Bariatric Services receptionist for a list of hotels that offer discounts to the families of our patients. Before you are discharged from the hospital, our dietitian or clinical nurse will check on you to make sure everything is going great and make sure your questions are answered. For every night that you are in the hospital, we recommend you take 1 week off from work. For example, for Roux-en-Y surgery, there is a 2-night hospital stay, and so you should take off 2 weeks from work. Follow-up clinic appointments are required at 1 week, 1 month, 3 months, and then yearly visits for the next 5 years. We want to see you because we care about your success. From a medical standpoint, it's hard for us to tell how you're doing via phone calls. We learn a lot more about your health when we see you in person. There are many metabolic changes that take place in the first year after surgery, and we need to track these changes with you when you come to our clinic. Also, to help ensure your success, we offer classes for our patients 3 months, 6 months, and 1 year after your surgery to keep you on track. They usually last 30 minutes, and afterwards you will always see a physician. Classes are set up well in advance, so if you would like to know the schedule, please ask our staff. Our dietitian is always available to answer your nutrition questions and discuss your concerns via phone or email. Depending on insurance, you may meet with a dietitian one-on-one or in a group setting. Bariatric surgery is just a tool. What is essential for your future success is a lifestyle change. This includes changing your eating patterns, new dietary requirements, appropriate fluid intake, taking vitamin and mineral supplements, as well as increasing your physical activity. It is best if you can start practicing these new nutrition guidelines today. First, you must eat 3 meals each day and no grazing. This is where many people develop behavioral problems. Also, some people skip meals during the day and consume too large of a meal in the evening. Skipping meals slows down your metabolism and can cause weight gain. Secondly, your diet will consist of foods high in protein such as meat, poultry, fish, and beans, foods low in carbohydrates, low in fat, and sugar-free. Protein is the most important nutrient after surgery, so you should eat protein at the beginning of your meal as it helps you feel full and is needed to maintain muscle mass. Protein malnutrition, a condition where you do not eat enough protein-rich foods, causes muscle loss, hair loss, swelling, poor weight loss, and generally feeling weak. To meet protein levels, you will need to drink protein supplements. A list will be provided for you in education class. You need to drink fluids in between meals, but not with meals. Stop drinking 30 minutes before a meal and wait 30 minutes after a meal to drink again. After surgery, it will be important to drink 64 ounces of fluid a day, but no more than 1/2 to 2/3 of a cup within an hour. However, you may not drink carbonated beverages since the carbonation may stretch and potentially damage your stomach pouch. This includes, but is not limited to, beer and both regular and diet soda. You should begin limiting caffeine in your diet since too much caffeine will make it difficult to stay hydrated. Also, you should not drink with straws because they will introduce air into your stomach. Over time, this air may stretch your new stomach pouch, causing it to hold more food than the surgery originally allowed. Following surgery, you will be required to take specially designed vitamins and minerals. This will be covered in detail in class. Please note the cost of vitamins and minerals is not covered by insurance. However, with improved health, you most likely will see a reduced cost in prescriptions that can help offset the cost of vitamins. Vitamin and mineral deficiencies include iron deficiency resulting in anemia, vitamin B deficiency that may result in permanent nerve damage, nausea, birth defects, and general fatigue, and calcium and vitamin D deficiency resulting in poor bone health, including osteoporosis or anemia. So, let's review the steps to begin your journey with Missouri Bariatric Services. 1. Call your insurance company to make sure that bariatric surgery is a covered benefit. 2. Fill out your entire new patient packet and go to your primary care physician and have him or her complete the referral form. 3. Once you verify coverage with your insurance company and your forms are complete, call our office to schedule your first appointment. Finally, now is the time to begin your new lifestyle, much as Melissa and others have.
Hi, I'm Melissa. Throughout this video, you've seen me go through my weight loss journey, and it has truly transformed my life. Over the past 6 months, I've lost 90 pounds. I can walk up steps without pain and do all sorts of things that I never thought I would be able to do. And I'm not alone. Other people have gone through the program at Missouri Bariatric Services, and they would like to share their stories with you too.
I feel like I'm living life now. I feel like life was just passing me by before. I went skydiving last summer. I signed up for a golf class. I'm taking a watercolor course this weekend. I'm in May starting scuba diving lessons. So I just feel like I'm really out there living my life at finally 40-some years old, and that I let the weight control me, and I'm not doing that anymore.
Now that I've had it and I've lost, all the weight that I've wanted to lose. I feel amazing. I go for walks with my children. I wrestle with them on the ground. I do things I never thought I'd do. I've been to water parks. I didn't think I'd ever go to a water park, and I went to a water park with my daughter for her Girl Scouts, and it was so much fun to go down the water slides with her and just feel great. Not only did I feel great, but people were complimenting and saying, "Wow, you look amazing. What did you do? How do you feel?" And all I can say is I feel great.
One of the biggest shockers is I've never been fit in my entire life, physically fit, and it's just really strange to all of a sudden start feeling, at 52 years old, athletic. And it's just a totally new experience for me.
I love to cook. I absolutely love to cook. And one of my biggest fears was not being able to cook, or I felt like I was going to be eating the same thing all along. And also, the way I was raised and the way a lot of people are raised, you don't waste food. And to see food go to waste, that was a big, I think, turning point for me, is when I finally was able to say, it doesn't matter. I paid for it. It doesn't matter whether I eat it, whether it goes in the trash. It costs me the same. It doesn't matter. Since then, again, I'm on some weight loss surgery boards online, and there are a lot of great recipes out there. There's cookbooks out there specifically written for bariatric post-surgeon people to eat off of, and that are higher in protein and lower in carbs. And it's great. It's experimenting. I can't even cook as many recipes as I have now available to me.
The Missouri Bariatrics team everyone was so wonderful and so helpful. I mean, anytime I called, they would, immediately get on what I needed and, direct me where I needed to go. And, with the paperwork, the doctor's appointments, if I, had any questions or concerns, they were always willing to help me. Even now, anytime I call, they're very, very helpful. And if I have a, question about, dietary needs, they're right there at any time, and they just help you through the process, and they're just wonderful. They almost, feel like family, like, we're here to help you, we're here to support you in any way and we can, and do anything we can do for you.
I had a lot of trust in my surgeon and in the team at Missouri Bariatrics. And I did a lot of research in choosing, where I would have this done for me. And, I happen to live here in Columbia, but I was not limiting myself, certainly, to just local source, for this procedure. And I think we're just lucky to have, a facility like University of Missouri Hospital and the surgeons and the team who did my surgery. And I felt, very comfortable with the care that I received from them, and it met all my expectations.
I do attend the Missouri Bariatrics support group meeting, and all the women there, and men are helpful, and we have people from Missouri Bariatrics come in, and we have discussions and talks, and it's basically anything anybody's having concerns about, whether it was something they ate, or they have a recipe to share, or somebody who hasn't had the surgery yet but has questions. It's wonderful. We all just, once a month get together and sit down and talk about things.
It's a team approach. You have a dietitian, you have exercise people come in, you have your bariatric doctor, the surgeon, the nurses. It's a whole team approach, and it's very interesting. You feel, because it's a long-term association, you continue to go back. I think you're there quite a bit prior to the surgery, and then after the surgery you go back at like 1 week after, and then 3 weeks after, and a month after, and there are multiple return visits, and it almost is like a family group, all working for the same ends. I think that everybody there really cares about the success of the patients.
Thank you for watching the Missouri Bariatric Services presentation. If you have any questions about our program, please call our clinic. We look forward to helping you on this life-changing journey.